Hi, my name is Edward, and my topic is about the effects of strength training on bone growth and development in children and adolescents. Um, oh, sorry. So there's a common myth that strength training during prepubescent and pubescent ages will hinder a child's growth height. For me personally, my parents have also enforced this myth on me, and because of that, I've always rejected the usage of strength training. And since I was very short, I've never touched like a dumbbell or a machine in my life until last year. And so a common belief among parents and community members are that during puberty, children should not be permitted to the usage of strength training, and because it'll have a lasting negative effect on height growth, and due to the unpredictability of the body during puberty, the body is really prone to injury, so strength training should be unadvised. I mean, not used. Um, Also for genetics, so it's been stated that 80% of height variation is due to genetic control, while the rest is environmental factors. And so um, sorry. So for like, although environmental might seem very low, as it's only 20%, it still is very influential for you. And environmental factors include the way you condition your body, such as strength training or diet or physical activity. So why strength training? Strength training is actually very important since it can improve procure muscularity, like building muscle mass and athletic development. So if you're like a child who's in competitive sports, you can increase your athletic abilities and compete with other opponents, compete with other teams. And increase in self-esteem, low risk of future injuries, and it also promotes body health. So the purpose of this paper is to study the correlation between strength training and height development, and through compiling studies to prove that potential benefits of strength training um, in height growth. So my methodology, I used PubMed for the most part, and I used a little bit of a few other academically reputable websites, and my search terms mostly consist of strength training, adolescence, height growth, and growth hormones. So at first I had 71 record screen, and out of those 471, I excluded 47 due to it being too specific or too general or not pertaining to the age group that I was studying, which is adolescents and teens. And then out of those, I had 27 full text articles assessed for eligibility, and six were excluded due to it being too specific about certain patients with like growth hormone deficiency, or just pertaining to those with obesity or osteoporosis. And since I wasn't studying too specific about that, I was just doing about adolescents. And with that, I had 21 left, 21 studies I qualitatively assessed. And so for my results, I had four different categories of results, which is the risk of injuries, growth hormones, bone density or growth, and testosterone. So for the risk of injuries, starting from the 1980s, the NEISS, or National Electronic Injury Surveillance, perceived strength training to have a high risk for youth. And so this set the foundation for the myth that strength training shouldn't be used or for youth and adolescents. And so deriving from that myth, a lot of the misconceptions or fallacies about strength training is due to the injury to growth plates, which can cause abnormal bone growth in children. So for example, if you look on the right, one leg could be shorter than the other, or one could grow crooked due to a fracture in the growth plate. And in fact, 15 to 30% of all childhood fractures are due to injuries in growth plates. However, most injuries resulting from strength training are because of improper usage of weights, like using too heavy weights, or the absence of professional supervision when using the weights. So which can cause, like, for instance, for example, like a 16-year-old football player try to attempt to bench 48 kilograms of weight without any assistance. And obviously the weights were too much for him, and he didn't have any assistance, which resulted in a fracture of his left distal radius, which is very dangerous to him. And contrary to like many beliefs about strength training, injury rates are actually very low. So in a conditioned experimental program where people use strength training under supervised conditions, and the studies out of 10 studies, only 3 reported injuries, which is an injury rate of 0.176, 0.053, and 0.055 per 100 participant hours. And in another study done in the UK for ages 13 to 16, a practice of Olympic weightlifting reported only an injury rate of 0.0012 per 100 participation hours. And there's also a focus on mirror muscles, which a lot of people, they go to the gym to look better, I guess, and build muscle mass in areas just for show, I guess. And so that can include like biceps, triceps, or like quads, abs. But by focusing on only those mirror muscles, you're disregarding a lot of other muscles that are like important for your core, which can cause injuries to back and trunks and disproportionate muscle growth. And also sports also hold a very hold risk for gradual fractures to growth plates. So it's not just strength training that can cause growth plate injury. Next, moving on to growth hormones. Growth hormone and insulin-like growth factor axis is the fundamental endocrine system that regulates linear growth in children. So the growth hormones are moderated through the IGF-1 and includes long bone effects of that, including long bone growth. So one study on the growth hormone deficient patients exhibited a linking short stature to the level of IGF-1 concentration in children, which means that the height growth, the statural height of children is correlates with the concentration of IGF-1 in the children. So higher the concentration of IGF-1, the taller he can be. So and also physical activity has proved to increase growth hormones and IGF-1. So strength training can increase someone's height potentially. Also, pubertal status is also very important in growth hormone response, since the further you are into your pubertal stage, the higher concentration of growth hormones you can produce. For bone density, strength training in youth is able to strengthen bone mineralization, which is beneficial to the bone density. One study required a training regimen requiring 10 jumping interventions 3 times per week for 7 months, which resulted in significant improvement in bone mineral at several bone regions. However, deficit energy intake through excessive training or overtraining can actually cause detrimental effects on the bone. But overall, physical training through strength training is recommended as long as you don't overtrain. Moving on to testosterone. While testosterone has not shown to increase the final height of adolescents, it's an aspect to be considered for further research. So there's a study done through the injection of testosterone on people with constitutional delay of growth. These injections proved to improve the first year height velocity of those, but didn't prove to increase the final height of them. So although that doesn't correlate to a higher increase in height, it's still an aspect to be considered. Correlation between high power resistance to increase in testosterone production. So there's a study done that there's a 32% increase in testosterone concentration after intensive training. Some limitations of the study and further research. So there's a lack of literature around the direct consequences of strength training that holds on like the height of the growing body. So I have to like research more about it, like the IGF-1 axis, or yeah, growth hormones, and testosterone, which doesn't have a direct effect, and lack of literature study regarding the differing effects of strength training on women versus men. So while men produce more testosterone, that could be like a reason why they grow taller than women, while like women produce more estrogen. But I didn't go too deep in that. Also, the application of strength training on those with skeletal or growth disease, such as osteoporosis or growth hormone deficiency. So to conclude, the benefits are such as like boosting. There's a low risk in injury, as long as you're using proper form, high production of growth hormones and IGF-1, improvement in bone density, and self-esteem. Plausible risks include injury to growth plates, although it's minimal, muscle strains, and energy expenditure, which can potentially slow the growth of adolescents. And ways to reduce the risks are using proper form and under the proper conditions, obviously. And if it's your first time, seek a guided training from a professional. And nutrition also is very important. And focusing on not just focusing on mirror muscles, but your core muscles too. Thank you.
Very well done, Edward. Thank you for your presentation. Does anyone have any questions for Edward? No worries. I have a question. It seems like a challenging thing because, especially in terms of adolescent use of weightlifting and exercising and things like that. I think like you presented great data with Olympic athletes, how they have such a low risk. But I wonder, since Olympic athletes usually have like more professional trainers who know like the limits versus like, I remember in my high school, it's just someone's dad that was a coach. So I wonder how that plays a role in the injury setting and things like that, if you could talk about it.
Yeah, so like that sort of goes into like in like conditions or like supervised training, I guess. I guess like people who just like do weightlifting or strength training without any like guidance or some sort are like more prone to injury versus someone who has like a mentor or somebody who can guide them through the process, which is like really beneficial to them. And yeah, so it's like highly supervised that you take your own risks by not like seeking out for professional training. And so yeah.
Great. And then one more question. What would be your biggest takeaway from your project?
My biggest takeaway would be like just like just like diving deeper into like the myth or like the fallacy that a lot of people believe in, which is that strength training will hinder a child's height, and like being able to dispel that fallacy. It just really intrigued me that like a lot of people believe that strength training is actually not good for you, it's deleterious for you, to your body and your height, but it could potentially increase your height in reality.
Great, wonderful presentation, Edward. We'll move on to our next presenter,